You want to say, I'm out in Salingandro here on the picket lines, CNA nurses and SEIU nurses are out here. And do you want to tell us a little bit what's going on?
Sure. Hi, everybody. So actually we have a lot more than nurses here. We have our rehab therapy department with occupational therapists, speech pathologists, social workers, physical therapists. We've got a lot of food and nutrition workers. We have EVS, which is housekeeping. You know, a lot of nurses, of
Healthcare
course.
workers.
Healthcare in general.
Yeah.
So it's a lot of people. But we're here today.
I should have said that.
That's okay. To send a message to our community, to send a message to the leaders that we are here because we are standing up for what we believe we need change in. In the Alameda Health System, we have been asking leaders for many, many months. We've been bargaining for at least 10 months now, and we feel like it's falling on deaf ears. And we've gone to the Board of Supervisors for Alameda County. We've asked that the structure, the governance of our system, our public health system for a safety net for our patients who deserve a lot of care here. We can't always afford to go anywhere else. We're just asking for better services. We're asking for a lot more change, a lot more accountability. We need, or for our old buildings, we need air conditioning and ventilation so our patients can be comfortable who live in our facilities. We've got really historically bad air quality with the fires that are going on here in California, and our patients don't have ventilation, adequate ventilation. We've got heat waves that are hitting us left and right, and our patients don't have air conditioning. They have to cool down by eating popsicles and chewing on ice, while management, unfortunately, is sitting in cool offices with a lot of air conditioning, and it's not fair. It's not fair to our patients.
Yeah.
The staff is also fighting for a lot of protections for our contract. We've been in, like I said, negotiations for 10 months, and we have not been able to reach agreement. And what we're seeing here, I'm part of the bargaining team, what we're seeing is there's a lot of changes and cuts that are trying to be made for our contract, and we can't stand for that. These are changes that we fought for many, many decades, and we can't just have it cut off.
Yeah, well, they're doing that to all unions, and they've done it for a long time now. And really, 10 months is too long, you know, at some point. But you're SEIU, so
yes.
And CNA is in the AFL-CIO now. It wasn't when I was active. But what's the Central Labour Council doing? I see they're having the leaders speak. But like I said to you about being pro-union, I've gone through many years of listening to Labour officials, top Labour officials, speak about how strong we are, but not bring out the numbers and show how strong we are.
Yes, the CNAs have been on the bargaining table with management for 2 years now without a contract. So They are very, very upset.
It's too long.
So. It's too long. We need to have a contract. So basically, union is the members. That's what we believe. And so if we are here, we're fighting for membership, we're fighting for the community, we're fighting for patients. We're not trying to make the group of unions stronger, we are making everybody stronger because the unions and the members go together.
You know, and the thing is if there's one profession, what this pandemic has shown is who's important in this world and who is not. And I mean, you've got a lot of support. Yeah, there's no doubt about it, particularly healthcare workers have got a lot of support. And so it's the time really to, you know, I said to a friend of mine who was feeling a bit glum, and I said to her, look, for 5 years, the heads of the billionaires that own the NFL were saying Kaepernick was wrong. And then after Black Lives Matter came out, and most of that was peaceful, that's what it was, they changed their minds overnight. So it shows what we have to do to make things. I've been on the negotiating team 3 times when I worked for East Bay Mud.
Oh,
you know,
okay.
and I was 3 different times from the 80s and 90s. So there's a time at which the talk has to stop.
Yes.
You know, they just wear you down.
Yes.
All right, so...
and I want to add also one more thing is, you know, we're asking for a good relationship with management.
What relationship?
A transparent and a good relationship with management. And right now we don't have that at Alameda Health System. That needs to improve.
My view, you may not agree with it, is that it's impossible because healthcare is a profit business. And any time we've won anything in this world, we've fought for it and they've resisted it. And look, even OSHA, right? They all resisted that, which is a toothless tool. And I laud you for wanting that, but unfortunately, I think as long as, particularly as we have it's a business in this country. And profit comes first.
But I think if we set our goals on quality patient care, at least that's the common ground between members, workers, and our management. So we have to keep focused on that.
Trump's getting quality health.
And he's still contagious, I hear. So.
Oh yeah. All right. Well, I don't know if you want to give your name. You don't have to.
I'm Stacy.
All right, Stacy, and you work up at Fairview.
I work in rehab. I'm a speech pathologist.
Okay. All right. Thanks so much for talking.
Thank you
Bye-bye.
very much. Bye-bye.